My first experience of the care sector was actually when I was about 5 years old. We moved back to the UK from Malaysia, and my parents bought a residential care home in Gloucestershire, and it sat in 5 acres of land. It was a beautiful Georgian mansion. You know, for a child growing up, it was everything you could want. I could ride around, I had all the space I wanted to play football. But actually, unbeknown to me, I think I picked up a lot of information and a lot of experiences along the way of growing up in that environment, living on site, meeting, spending time with residents, with relatives, but also obviously with the staff there, with the care workers, seeing how hard they work and actually seeing what it took to deliver incredible care firsthand and close at hand. So that was my first, I guess, formative experience of the care sector. I've got so many incredible memories from growing up living on site in a care home. You know, as a young child, for me, it was like having 35 grandparents who wanted to spend time with me. They wanted to spoil me at birthdays and Christmas, sneak me biscuits when my parents weren't looking. I think from the care staff perspective, maybe not so fond of me. I was probably quite an annoying child, from riding my bike around, from kicking footballs through windows, to throwing fir cones at them to scare them when they're walking back to their car. But I guess it was all these experiences that have kind of given me the knowledge of what it's like to spend time in a care environment and in a care home. And it's that knowledge and experience I draw on 25 years later still, and contributes to how we approach the work that we do at Conteur. Having spent 15 years living in and around the care home, I headed off to university. When I came back, I fell back into the care sector, I guess. I worked as part of a marketing team for a national group of care homes. Then moved on to a business development role with a small group of learning disability services. And eventually ended up working for a home care company in domiciliary care as a registered branch manager for 5 years. Ran a local authority contract in Worcestershire for, I think it was between 750 and 1,000 hours a week. And so I suppose I've been both sides of the fence. But my passion remained in kind of business development, public relations, marketing. But I guess what was really good was I was still able to bring that experience from having grown up in the care sector to actually frontline services and how I'd seen care being delivered to how I wanted care to be delivered under my management. But then moving into the more the marketing side, we launched Conteur, and moving into social care, specialising in health and social care, was very much a natural progression, because we'd gained so much knowledge, and I'd gained so much knowledge and experience through going up in the care, living in and around the care sector, but also then having done the job, been through the likes of CQC inspections, obviously the registration, the infamous registration interview, and just being able to, I guess, bring all of that alongside my passion for the industry, for the sector, to actually be able to tell stories about incredible care workers and actually showcase the thousands of incredible care providers across the UK, to just work with a small selection of those and be able to tell their story, I felt was a really important role to be able to play in the sector and in promoting the sector. We all know how challenging it can be to work in the social care sector right now. We face operational challenges, financial challenges, but also poor exposure in the media. It affects recruitment, it affects reputation. So if we can play, in our role as a PR and marketing company, if we can play a small part in promoting not only the clients we work with, then for me, I feel like I'm positively impacting and positively able to impact the sector as a whole. I know that I draw on those years spent growing up and living in and around a care environment, alongside the time spent working in the sector on the front line as a registered manager. I draw on that experience every day in the work we do across Conteur in promoting providers and telling the stories of care workers, and also protecting reputations. And I guess it's that understanding of how a care provider and how care delivery works, and the tone and the language and the challenges they face, whether it's through crisis communications, protecting a care provider's reputation, whether that's through video production, helping people to recruit and retain care staff. That experience, that unique experience that I think I've gained across those years, contributes to every aspect of life at Conteur, and it also enables me to keep keep my passion alive in terms of social care and keep contributing to the industry and the sector positively.